crown, your cast metal crown. So cervical margin is at the level of or 1.5 millimeters occlusal to the gingival margin. So that's right here. So this margin here is less than or equal to 1.5 and here. So that one's good. You got it. Check on that. Cervical margin is continuous but maybe slightly rough. So what they're looking at here is this continuity of this margin. We should be able to follow it all the way around the tooth, which I can on this angle, and then around the back. So check on that one. Margin varies slightly in width from vision and explorer detectable to less than or equal to 1. That's this one right here. So this margin right here is less than or equal to 1. Be careful because the metal one is very slight. So it's not even the width of the tip of the some of the burrs. So you don't want to overdo it. But I think you're good. I think you got it. Check. Path of insertion and line of draw deviates less than 20 degrees from the long axis of the tooth. This is the long axis of the tooth. And then we look at the path of insertion and you're good there. It's definitely within 20 degrees of the long axis of the tooth. Axial tissue removal is 0.5 to 2. That's this one right here. So we want to stay under 2 and over 0.5. I just think like everything, if you just go about 1, you're going to hit it. So this is about 1. This is about 1. This is around 1. This is around 1. So just around 1 and then tweak a little bit. That might be a good kind of like overall rule of thumb for this one. Taper is present from nearly parallel to less than or equal to 12. So the only one criticism again is you didn't do dual plane of reduction. So you're pretty much parallel here. This side you did do that. So this looks good. But on the buckle you didn't. It's more of a straight. So if you do your dual plane of reduction, it'll also help with your taper. So you can see how it's closer to the putty at the more occlusal aspect than here because you didn't follow the shape of the tooth. So it should be a little bit more rounded here. It's still within the parameters, but it just helps to not over reduce if you do a dual plane. And then finally, occlusal reduction, 1 to 2. We got that. That's good. So great job on this one. I don't think you would get any subs on this. I think this is probably just going to be a good passing one. But, you know, if you want to improve something, just work on your dual planes. On both of the preps that you showed me today, you didn't do dual plane on the facial.